A very good evening to and welcome to Rwanda Television News. My name is Sam Kalisa. To kick off tonight's edition, let us inform you that on Sunday morning in Brussels, a president of the European Union Council, Charles Michel, welcomed President Paul Kagame to the council, where he joined the current AU chair, President Felix Tshisekedi, President Macky Sall, and the chairman of the African Union Commission, Moussa Faki Mahamat, for the AU-EU roundtable in preparation for the AU-EU summit that will take place in February next year. Later on Sunday evening, following the roundtable discussions, Presidents Paul Kagame and Felix Tshisekedi also met and held discussions. And to other matters, this Sunday at different churches, COVID-19 vaccination sites were set up where people were getting vaccinated from. Only those who were fully vaccinated were allowed to attend church services. This is in the process of preparing for the implementation of the recent cabinet meeting resolutions regarding COVID-19 prevention that will take effect on Monday, 20th December. Without the story. To enter the church, everyone first presented proof that they were vaccinated against COVID-19. Those who were found unvaccinated were immediately asked to get the vaccine from the sites that were set up. Some of them said that they were afraid to get the vaccine due to differences in opinions, whereas others had waited for the pandemic to disappear. Because of the work I do, I lacked time to get the vaccine. Sometimes you could talk to people who have been vaccinated and they could tell you the side effects of the vaccine, so you could fear it. I have taken the first jab, but it felt like everything is normal. Nagunjira Jean Bosco, the chief priest at Regina Pacis, one of the churches where vaccination sites have been set up, noted that the decision was aimed at helping members understand the importance of COVID-19 vaccination, something that have been recurring in their previous teachings. Those who have been left out should get vaccinated so that they can be eligible to enter the church in the near future. We started this to awaken people so that they can get vaccinated, because we know the importance of the vaccine in protecting you and others. Local authorities in the city of Kigali are monitoring the vaccination campaign, especially in crowded places, and are encouraging city residents to get vaccinated. We encourage residents to tighten preventive measures because COVID-19 kills. Even if it doesn't kill you, it will leave you with side effects or even put you in the hospital, which will hinder your activities. So we encourage residents to prevent themselves and follow set guidelines. The cabinet resolutions as of December 17, 2021 announced the introduction of new COVID-19 prevention measures which will take effect from Monday, including a curfew from 10 p.m. to 4 a.m. and only those who have been fully vaccinated against COVID-19 will be allowed to attend public gatherings. Some of the most vulnerable people across the country who receive support as part of Rwanda's social protection initiatives agree that signing performance contracts is helping them to attain set goals and eventually overcome poverty. Serge Nore has the report.
The beneficiaries of such support are classified under the Village Umurenje program, or VUP as it is generally referred to, given jobs and paid every fortnight. The addition of performance contracts that help them to make progress is another feature of their assistance that has been helping them to significantly transform their lives. I had no house of my own before, and now I have constructed one and even bought goats. I used to live down in the valley in a high-risk zone and was constantly sick. I was eventually able to leave, came here and built a very small house at first, but it was a start. I then joined the VUP initiative and worked while saving my money. I was actually part of several savings groups. After I had saved enough money, I built this house. You saw my cow in the back, and it's shed, and that too is properly cemented. District officials maintain that beneficiaries signing performance contracts is the only way to get them to improve their welfare enough to no longer need government support, so that their resources can then be used to assist others. People part of this initiative receiving support are supposed to develop as fast as possible so that they can make way for others who need help. Some of them just sit there content with receiving the support and really misusing it, purposefully not making any progress. Officials at the local administrative entities development agency agree that the performance contracts have been yielding results. The results of their saving their money can be seen in the assets they begin accumulating, houses, livestock, and income-generating activities that they begin engaging in. That is why they need to sign performance contracts to progress so that they can set goals and milestones of reaching them, starting in January and not waiting for the end of the year when the audit is upon them to start thinking of such things. During the 2020-2021 fiscal year, the government of Rwanda spent more than 60 billion Rwandan francs to assist more than 300,000 beneficiaries as part of its social protection initiatives.
Now, more than 600 people with albinism around the country say they were pleased with the way they have been given tools such as skin oil to help them avoid skin cancer that might result from exposure to sun rays. However, they made a request for such products to be included on the community-based health insurance scheme. We do have more with Martina Avera.
This is at Masaka Hospital, located in Kichoshiro district. A doctor is treating a patient from skin rashes that could result into skin cancer if not treated on time. Dr. Gasarabge Amiel is a dermatologist. He explains the importance of applying this kind of treatment when it is still early.
Hari kanseri z'uruhu ebyiri zikunze kwigaragaza mu bafite ubumuga bw'uruhu rwera.
There are two types of skin cancer common for people with albinism. One is called the basocellular carcinoma and the squamous cell carcinoma. They are first indicated by skin rashes. So when those rashes are discovered earlier, we treat them using cryotherapy, and this can help prevent cancer at the rate of 90%.
The treatment was given to many patients around the city of Kigali and others from the secondary cities who wish that these skincare products can be brought closer to them.
It is not included on the health insurance. We buy on our own, and that is a problem. We are requesting that these projects be put on the health insurance so that we can access them on time. You only take your health insurance and just pay 350 Rwandan francs depending on your Ubudehe category. But there are other children in other districts who doesn't access the products using health insurances.
James Mugume, chairperson of the Health Alert Organization, explains how this issue is being addressed.
We have a stock for all those products, and we will be distributing them from the beginning of the next year. We are recently in Rutsiro district and other areas of the country. In partnership with the government, we will be providing the products at the health centers. That's the plan next year.
Currently, about 380 people in 9 districts are officially recognized as having albinism, though another 210 people in other parts of the country have also come forward and presented themselves as albinos.
On behalf of the entire news and technical team that made it happen, thank you very much for being with us. My name stays Sam Kalisa, wishing you a safe evening and a fruitful week ahead.